Hello, welcome to my channel Medical. Today we are going to discuss about blood coagulation. The topics we are going to discuss are introduction, coagulation factors, mechanism of coagulation, hemostasis, and investigation of bleeding disorders. Let's go one by one. Introduction. Bleeding occurs when the blood vessel is injured. It stops by the process called hemostasis. Hemostasis is a complex process that involves three major steps, including coagulation. Coagulation is brought by 12 coagulation factors. The coagulation factors are discovered by order. There are 13 numerals but only 12 factors. Factor 6 later turned out to be activated from 5. Hence, 6 is not now in active use. Let's know about coagulation factors. In circulating plasma and tissue surrounding by the blood vessel containing 12 coagulation factors. These coagulation factors have various organic compounds like proteins, coenzymes and inorganic element like calcium. In under normal condition, in circulation, these coagulation factors are present in an inactive form. Whenever there is injury, these are converted into active form. The 12 blood coagulation factors are mentioned here. Factor 1 is fibrinogen, factor 2 is prothrombin, factor 3 tissue extract or tissue thromboplastin, factor 4 calcium, factor 5 proaxelerin, factor 6 is combined with factor 5, factor 7 proconvertin or stable factor, factor 8 antihemophilic factor A, factor 9 antihemophilic factor B, plasma thromboplastin component or it known as Christmas factor. Factor 10 is power factor. Factor 11 plasma thromboplastin antecedent or antihemophilic factor C. Factor 12 contact factor. Factor 13 fibrin stabilizing factor. Platelets are not included in this list of coagulation factors because platelets release several factors that help in clotting process. Let's study about mechanism of coagulation. The mechanism of blood coagulation is necessary and significant to understand the routine coagulation test. Any of the deficiency of coagulation factors disturbs coagulation process. There are three stages. We know one by one. First, stage 1, the tissue extract or tissue thromboplastin 3 enters the blood vessel through the site of injury and combines with factor 7 and calcium. It's a factor 4. This is known as extrinsic system. As the reaction is going on out of the blood vessel, the extrinsic system then joins with the intrinsic system. The blood vessel, the factors that participate in intrinsic system are all present in the blood circulation. The factors are 12, 11, 9, 8. Now, extrinsic and intrinsic system joins together and follows a common path. This react with factors 10, 5 and calcium to produce plasma thromboplastin. The end product of stage 1 is plasma thromboplastin which enters in stage 2. Any defect in intrinsic system of stage 1 is recognized by the activated partial thromboplastin time. It's APTT. Let's know about stage 2. In stage 2, prothrombin factor 2 is activated by plasma thromboplastin which is the end product of stage 1. This results in formation of active thrombin. If there is any defect in stage 2, deficiency of factor 2 will be recognized by prolonged prothrombin time. It's PT. Let's know about stage 3. In the final stage of coagulation process, inactive fibrinogen is activated by the end product of stage 2, thrombin. The fibrinogen is first converted in soluble fibrin. Soluble fibrin polymerizes with the help of factor 13 to form insoluble fibrin clot. In this way, the formation of blood clot, 12 coagulation factors work in coordination with one another. Hemostasis. Hemostasis is a complex and highly regulated physiological process that maintains the balance between the liquid state of blood within the vasculature and the induction of blood clot formation following injury. It involves multi-system interactions between components of vessel wall and blood cells, many platelets and plasma proteins. The following events are involved in the hemostatic process. First, vasoconstriction. When the blood vessel ruptures, the wall of the vessel immediately contracts to reduce blood flow and thereby prevents blood loss. Second, platelet activation. Platelets added to the vessel injuries von Willebrand factor and aggregate with fibrinogen to form platelet plugs. This is primary hemostasis. Third, blood coagulation. Clot formation occurs as a result of coagulation that is mediated by blood clotting factor. Fourth, fibrinolysis. The blood clot is dissolved when healing is completely, thereby assuring long-term vascular. Next, investigation of bleeding disorders like bleeding time, clot retraction, prothrombin time, activated partial thromboplastin time. Let's discuss this one by one in next class. Thank you for watching. Like, share and subscribe.